Have fun, be safe, and don't talk to strangers. Also, well, wait. This isn't... Wait.
Well, hello, Dr. Seal here, Junior Doctor from Australia on the Psychiatry Training Program. And I've actually gotten a couple of comments about one of the special books by Special Kids recent videos. It's titled An Autistic Man with Schizophrenia and Psychosis, Blurred Lines Between Reality and Hallucinations. And I absolutely adore the Special Books by Special Kids YouTube channel. And I thought, absolutely, I'll react to it. I'll react to anything. If you guys want me to react to things, just leave links to the things you want me to react to in the comments, and I'll do it. So here we go. Let's check it out. I think before we check it out, I should just say that autism and schizophrenia do coexist regularly, and one does increase the risk of the other. It is a tricky dual diagnosis and very complex, and particularly complex in it is risk assessment, because people with autism and schizophrenia do typically have kind of increased risks of agitation and aggression. I'm not making a comment about this guy. I'm just saying in general, those are questions you have to really focus on. History of aggression, agitation, and just get a good risk assessment. Let's check out this video because it's gotten millions of views in just a couple of weeks. So it's clearly very interesting to people. So I'm excited to check it out.
Well,
Do you see something right now?
yeah, but I'm going to ignore it.
Why is it a good idea to ignore it?
Because that's what I should do while I'm busy in the middle of an interview, like when you were giving me so many questions.
Are they talking to you now? Yeah. Just fight it, baby. It's gonna be okay.
How can you tell?
Because he's staring off and he blinks like that.
Is it easy to be your friend if somebody's willing to try?
Well, I am difficult to try. I am difficult, but also the same.
Why are you sometimes difficult? Can I ask you a question?
Yes,
Did you just see or hear a hallucination?
just seeing a hallucination. A hallucination is something that you thought you see something, but it's not truly there.
Can you tell when something's a hallucination or if it's real?
Not always.
Is it sometimes hard for you to describe what's going on in your mind?
Yes, it's almost like millions of voices of me fighting in my head.
What does that feel like?
Hurts. I couldn't understand myself. Sometimes.
You can't understand yourself?
Yeah, sometimes I can't.
Are you learning to explain it more?
Yes, I am learning.
What have you learned?
I learned that my schizophrenia and my autism is not something that should be overlooked by other people, other peers, because it's a very serious situation.
If you had one wish, what would it be?
Tell all the bad guys and bullies to go away for good.
Are the bad guys and bullies you're referring to real or hallucinations?
Both.
What do they do?
Try to annoy me with their hate, messages of hate.
What?
All right. Look, I think we should, we're 2 minutes in, I think we should make some reflections for this young man. I wonder what his name is. Sorry, I don't have his name. So, very interesting mental state, and it's kind of him to share his story. And I think it's really, really helpful for people to see this, especially if they have schizophrenia or autism. I guess what I find marked initially is really a reduced range of facial expression, a restricted affect is what that's called. So he's got this kind of, I don't think his eyebrows have moved really this whole time. He's got a bit of a slowed blinking, and I've noticed a bit of perioral movements, which could be him talking to voices, or it could be side effects from medications. But so in terms of the content of what they've been talking about, I've noticed he's distracted by internal stimuli, probably like his mother or his caregiver. I'm not sure who that is in relation to him, but in terms of the lady with the purple shirt, she can tell when he's getting distracted by voices because he stares off and he speaks, or maybe he mumbles to himself. So that's very common, and you can imagine how difficult it is to perform, a job, cognitive tasks when you're having this internal distractions 24/7. It's common in what he's describing, these auditory hallucinations, like having millions of voices. And I've heard this a couple of times where people get millions of voices and then they'll just have spikes of a certain voice that kind of dominates and says, usually some ego dystonic negative commands. And what I mean by that is, he doesn't want to hear negative voices bullying him, but what he's describing is that they're saying things. So it's dystonic. It's not what he wants. It's not consistent with his values. And and sometimes they're commanding. They tell people to do things like hurt themselves. And that's why suicide is such a big risk factor in psychotic illness. The other thing I wanted to comment on is visual hallucinations. Very odd to get visual hallucinations in schizophrenia. I don't know if having autism increases your risk for visual hallucinations. Usually visual hallucinations are a result of organic brain pathology. So what I mean by that is like either a medical process or like an encephalitis, an inflammation of the brain, or a delirium, or drugs. Drugs are very commonly a cause of visual hallucinations. Primary psychotic processes are not a common cause of visual hallucinations, and it makes you question the diagnosis. So I'm wondering if he really sees them or if he hears them and describes that as seeing them, because that's common. What you can get in schizophrenia is delusional misinterpretation of stimuli, and you can get illusions. So you see something in the corner of your view, like you might see this plant behind me, but when you're staring at me, the plant might morph into some devil or something. And that's an illusion, not a hallucination, because the difference is in a hallucination, there's no sensory input. It's just generated from the brain. But in an illusion, there is a real physical sensory input. This plant is there, but you're misinterpreting it in your perceptual processes in the brain. I guess we could also comment on some negative symptoms. So psychosis can have positive symptoms like hallucinations and delusions, but it also can have negative symptoms. So alogia, lack of speech, and poverty of content, which, I don't want to be too harsh to him because he is kind of bringing some things forward, but he is giving quite simple, short answers. And whether that's because of a poverty of content, lack of thought as a negative symptom, or whether that's because he's getting distracted by internal stimuli, I don't know. I'd have to talk to him for longer. So let's keep watching.
Voices you hear?
Well, not always. It's just the voices. It's just sometimes I can see them more than anyone else can see them.
What do you see and hear?
Sometimes it's just people, spirit like people, and it's scary, but at the same time it's wonderful to have my imagination like that, because that's all I usually have. It's my imagination, and it's my safe haven, and I don't have to feel like I'm alone.
Wow, I've never heard auditory hallucinations kind of described in that way, and that's super interesting and positive. You should use your internal experience to generate creativity and connectedness. Sure. So I think art would be a really important part of this guy's treatment, so that he can, the problem is treatment would probably a successful treatment would reduce auditory hallucinations so that they don't at least bother him too much. And I can imagine that the fact that he actually likes it at times could cause a compliance issue with medications. So that would have to be something negotiated, like essentially how far do we have to turn the dial? Because you rarely can turn auditory hallucinations all the way off. Usually it's like you're just turning the dial down to 20%, which is better than 100%. Interesting.
Have you ever felt hopeless?
Yes, I have.
How would you describe that feeling?
It's like when I hope someone would come over to meet me, and then they don't do that.
Do you wish more people talk to you?
Yes, in a positive and very positive manner.
What's something somebody can say to be positive to you?
Hey, you look nice today. I need some.
This is common in autism, where they have issues in social reciprocity and understanding how other people feel, but that's not to say that people with autism don't want to connect, and often they do, and they're struggling to connect deeply with another person because they don't understand naturally the body language and the feelings and what the other person is going through, and it can make them really frustrated, and they have it's very hard to deal with that frustration. So that's an interesting observation.
Hey, Mama. I can make some more iced tea.
In a little bit, yes.
Talking about this stuff, is it tough for you?
Yes.
Do you want to escape when I ask you questions about this? Is that because you feel like I might not understand? Do you want me to understand?
Yeah.
Love this channel. Great interviewer. These are very leading questions. I think instead of saying, it's difficult when someone has a poverty of content and isn't giving you much information to ask open-ended questions. But the better way to have asked that would just be like, why do you feel uncomfortable when I ask you questions? Instead of saying, is it because you think I might not understand, which is a yes or no black or white question. Asking a why question is an open-ended question, which puts the onus on the interviewee to explain why. There's so many more things he could have said. Because I wonder if it's really that, or if he's just saying yes because he's agreeing with a leading question. I wonder if it's more that what's very common is voices telling people not to answer the questions. But if I'm 5 minutes into an interview and I'm working in the emergency department and I've got people waiting for reviews and I'm pressured, I usually give 5 minutes of open-ended questions, and then I'm quick to get to yes or no questions, because you got to make you got to get your assessment done.
What do you want me to understand?
To understand that these things are in my head. You just gotta not give up on me and keep on saying that until they're gone.
I'm not giving up on you. And I'm not judging you either. I'm asking questions because I want to understand.
Oh, okay.
Because I want to be your friend.
Okay.
Is that...
Wow, interesting change in his expression there, and evidence of kind of misinterpreting the social cues. I mean, obviously this interviewer is super nice, he does this all the time, but this gentleman in the red jumper is feeling like he's not nice. He's not able to read the social body language and tone. He's not hearing the tone. Interesting fact, the words we use are actually only a small percentage of how we're understood. So I can't remember the exact numbers, but roughly, if I'm to say, I'll get out of here, the words I'm using are only about 20% of the meaning of that statement. My body language is 40%, and my tone is the other 40%. So tone and body language say more than the words we use. So get out of here. That's obviously like colloquial, jovial, but get out of here. That body language, that's a totally different meaning to the listener. And so if you have problems in social reciprocity, it's very hard sometimes to read the body language and the tone, even if the words are clear.
Okay.
That's absolutely A-okay. I will feel if one person out there in the world understands me when they see this video, I just want to say thank you. Thank you for watching this.
This is universal, right? The wish to be understood. That's a very core part of being human. The wish to be understood, empathized with, and validated. Everyone wants that.
Do you feel understood?
Yes.
Why?
Because I just feel that I don't have to worry about anything. I don't have to worry about fear anymore.
Do you know I accept you just as you are?
Yes.
What have I done to communicate that to you?
Help me get back on my feet and be brave again.
What does Miguel's schizophrenia look like when it's at its worst?
Oh my God, he's yelling and screaming at himself. He's
Going
walking
berserk.
around, talking to the people that's in his head, and one's telling him if he's to eat dinner or take his medicine, they're going to take it from him. He's choking It's at its worst. It's almost like just watching a bad dream.
Wow.
But it's your own child going through it.
That's why I stay in your room. So
I know you feel safe in my room.
Are you experiencing something right now?
huh?
Did you?
These pursed lip movements that he's doing, I don't know if that's an autistic stimming, which is when it's kind of like a tic that people with autism might do, or a stereotypy, which is like a repetitive, purposeless behavior. But what it could be, which you have to be very cautious of, is something called tardive dyskinesia, which is a side effect of antipsychotics long-term use, especially the first generation ones. It's called an extrapyramidal side effect, and it's difficult to treat. So if you catch it early, you've got to treat it early, which usually involves changing medicines, and it's a pretty complex treatment, which I won't go into for this video. But he is getting these pursed lips, and the question is it voluntary or not? So you'd have to ask him to like try and keep his lips still for a full minute and see if he's able to. Let's keep watching.
My question?
No, can you say it again, please?
Are you experiencing something right now?
Well, yes. And the experience of this is hanging out with my new best friend.
Are you talking about me or something else?
Talking about you.
How can you tell that I'm your friend?
Because you're real.
And you're real. And we're experiencing something real.
Yeah. Do you have this experience before?
I have. It's friendship. And it's a nice thing.
Really?
How do I feel about this? This is interesting. I guess if it's true, it's fine. It's important also to set boundaries in interviews. It would be very untherapeutic for Miguel to become attached to the interviewer, and then the interviewer never see him again because the interviewer is doing a tour of America or something. So you know, it's just important that you know, Miguel is vulnerable to becoming overly attached because he's you know, socially lonely and doesn't have social skills. You know, he needs to be trained. They're not natural to him, and so you know, he's vulnerable to becoming overly dependent on someone. So connecting to the point, to saying it's a friendship after the first time they're meeting, okay, maybe, but also maybe not, and you got to just set healthy boundaries to vulnerable people.
Do you ever work with doctors who help you understand yourself?
Not everyone understands me. Not every doctor understood what I'm trying to say.
What didn't they understand?
They don't understand that I'm a different being, and I don't like being part of the norm.
I've been asking you a bunch of questions. Do you have any for me?
Yeah. What do you think about me?
I think you're an awesome guy.
Why do you think I'm an awesome guy?
Because you're honest and you're working to get better. Those are two of the best qualities in the world. Do you often wonder what people are thinking about you?
I think right now they're thinking of how brave I am.
Everyone's thinking that. If you could send a message to the whole world.
So that's pretty rare. Like that's a sign of a good level of confidence and high self-esteem to say that he feels people are thinking how brave he is. So that's very positive.
What would it be?
Have fun, be safe, and don't talk to strangers. Also, well, wait. This isn't. Wait.
That's a lot of
This
pressure.
isn't a PDA thingy. Never mind. Well, but on serious note, I just want people to be happy and healthy with each other instead of being there all by themselves.
Do you ever feel like you're all by yourself?
Sometimes, yes.
What is that like?
Lonely. And I can feel some sadness, too.
So he was born premature.
That's very good that he's self-aware around his his emotions. He can feel lonely and sad, and it's good that he can put words to that, because some people with autism really struggle to describe how they're feeling, and so it manifests physically in behavioral disturbances and rocking and head banging and agitation and that's very positive. She's about to say he was born premature and underweight, which is very interesting, because this is what I was suspecting, that there was an organic brain pathology, like brain damage. And that's probably now explaining a bit more about why he sees visual hallucinations, which is very uncommon in like just a schizophrenia that's, a primary psychotic process, but more common in schizophrenia that's secondary to an organic brain injury. And although being premature is just also a risk factor just for schizophrenia. So let's keep watching.
3 pounds, 10.5 ounces, and he's just been going through something every day.
I, in a way, I cheated death.
That's
good confidence.
How?
I was the luckiest person alive.
Do you feel lucky to be alive?
Yes, I do.
Are you happy you're alive?
Sometimes I am, sometimes I'm not, but mostly a yes.
He's got a very good mood. You know, this guy's not suicidal. He's future focused. He's happy. It's very positive.
Aren't you?
When I get messed with by people and people didn't care like the public schools did.
We have this camera and you can see yourself on that screen. How do you feel when you see yourself?
Well, depending on mood, I say some half confident of myself and half unconfident of myself. But today, I feel confident by myself.
Why do you feel confident?
Well, it helps me develop and grow to be a better person. And I've learned from that.
That was a great answer. What is causing you to feel confident?
You, my mom, and my sister.
Having to support you.
Shows you how important psychosocial supports are. And it's not just medicines. I think medicines are very important with, helping the intensity of hallucinations and the, mood of a patient. But it's also important that they have good social supports and psychosocial supports, so family and support workers who come and visit. So in Australia, we have something called the National Disability Insurance Scheme, the NDIS, and so if someone has autism and schizophrenia like this gentleman, they would get support workers who visit them every day and take them out and do activities and go to the park and watch movies and play ping pong and all sorts of good stuff. And so it's very expensive to the country. It's not a cheap intervention, but it's very important for the fact that this guy, people like this guy have meaningful lives.
And I think that we should all talk about what we're experiencing. Do you feel better or worse when you share your experiences?
I feel a little better about myself. I feel that I can do things the way it's right and try to fix things around. Hopefully I'll make sure that that I do good and make sure that I understand that many people are different, and people should respect that our society in today's world doesn't care about us as much. We have to always defend for ourselves, and sometimes I feel that our society needs to know that we can't fend for ourselves all the time.
Is he who he is?
So I'd like to retract what I was saying earlier about poverty of content. This guy does have things he wants to say. I think maybe earlier in the interview he was a bit shy and was giving very short answers, and maybe he was getting distracted by auditory hallucinations, but obviously when he's warmed up to the interviewer, he's now a bit more forthcoming. So he doesn't have that alogia or lack of speech or lack of content that I was referring to earlier, which is positive, because really it's the negative symptoms of psychosis are very difficult to treat. Someone with a catatonic schizophrenia who just sits all day and doesn't move and just stares at the wall for 20 hours a day, that's a very horrible kind of life. So it's positive that he's got ideas and he's forthcoming.
In his worst moment, his best moment, or a combination of everything?
Everything, because me being a mom, truthful, I got love the good, the bad, and the ugly. So everything all tied up in one is my Miguel.
Before we end this interview, is there anything else you'd like to say?
May the power protect you always. And may the force be with you.
May the force be with you too.
So interesting that he ends on a kind of sci-fi Star Wars note. But may the force be with you. People with schizophrenia and autism can have very exciting fantasy lives and imaginations, and I think that'll be an important part of anyone's treatment to kind of to engage with that and to do art and use it as an outlet for the troubles of the day. Miguel also referred to a history of bullying, and that can lead to more isolation, which is a problem. So having an exciting fantasy life is usually a good thing. It can at times be a bad thing, so you have to manage it case by case. But overall, very interesting interview, and we saw some interesting signs of autism and schizophrenia, and issues in the social reciprocity, issues with the visual and auditory hallucinations, and the risk factors with prematurity at birth. So I hope you found that interesting. If you did find it interesting, please like the video, subscribe to the channel, and leave a comment to any other links you want me to react to. And I wish you all just a beautiful day full of love, and I'll see you all in the next video. All right, bye for now.